This is our debriefing. We had buyout today. We had 24 horses come in. Dr. Gina and I are really tired, so bear with us. We're going to go through and we're going to tell you guys physical exam findings on each of these horses. It was a really tough day. We had to give a lot of animals the last act of kindness, and I always kind of say ahead of time, if we don't tell you that we gave them pain medications, they got pain medications, but we don't always remember to say that. So.
And we tried to do the same thing this time that we did last time, where everybody had kind of like teams and roles. So Dr. Lydia did a lot of the firsthand primary exams, and then animals that she thought needed further diagnostics like ultrasound or radiograph would then come to my team, unless she was tied up and needed us to kind of keep rolling through, and then I would step in and do physical exams on some animals. So
Dr. Gina catches all the things that I missed.
Oh, that's not true.
It is true.
It's chaotic. Buyout days are chaotic. So sometimes certain areas are quieter than other areas, or there's a lot going on in one area, not so much in the other. So that's why it's good to have teams.
We know that numbers are very impersonal. All of these animals will receive names, but our supporters name them. So we just have B numbers for you today. So our first horse, B2550, was an 8-year-old Tennessee walking horse stallion. He was black and beautiful. And he came in with a resting heart rate of 67, which is quite elevated. His respiratory rate was elevated. He had a grade 4 out of 6 systolic murmur that had a point of maximum intensity on the left side of his chest. He had nasal discharge bilaterally, and unfortunately, he had a big wound over his right dorsal hock and his right dorsal fetlock on the right hind that was very big and putrid and had a draining tract. We collected a nasal swab. Dr. Gina took radiographs of that joint, and not only was the fetlock fractured, but there was a lot of evidence of sepsis and infection that had invaded the bone. And he was very painful and non-weight bearing lame on that leg, and he was given the last act of kindness. And lots of cookies.
All right. B2551 was a 26-year-old mare. She's paint.
Yep.
1 out of 9 body condition, so she's really, really thin. She also had a heart murmur, a grade 4 out of 5, or 4 out of 6, it should be. PMI, left chest, holosystolic, mitral valve regurg most likely, but without putting the ultrasound probe on there and actually diagnosing it that way, we can just go based on location and the sound that we're hearing. She had discharge out of her right eye. She got Banamine, which is our pain med NSAID. Her right eye was closed with the draining tract, and she looked like she had probably had bilateral lid resections. So horses that have white around their eyes are common to get squamous cell carcinoma, and usually lid resections are the best way to kind of get the cancer out. So she looked like she might have had that procedure. She also had a really foul odor to her face. We took some radiographs, and it looks like she had some abscesses around some of the roots of her teeth. So we got a nasal swab of her, but based on everything, suspicion of neoplasia, last act of kindness was given to her.
She also had that really bad melting ulcer
in the right eye.
B2552 was a 25-year-old branded standardbred mare. We were able to look her up based on her brand, and her name was Super Smokin'. She had a lot of scars over her body. She had white hairs in the pattern of a halter and a big area over the dorsum of her nose where she had no more hair growing. Her heart rate was in the 70s to 80s, and she did receive pain medication. Her left front leg, when she stepped, failed and the toe would come up off the ground. So she had, I wrote, failure of the suspensory apparatus, the big soft tissue structures that are responsible for holding the leg up. Dr. Gina and her team took radiographs of the left and right front fetlock, and there was severe osteoarthritis. There was rotation of the whole foot. There was a lot of medial to lateral imbalance. She had a fractured area of side bone, and the radiographs further confirmed that the suspensory apparatus had failed. And when that happens, there's nothing that we can do to correct that. And she was given the last act of kindness.
All right. B25-53 was a 32-year-old pony mare. Her heart rate was 56, which is elevated. She had a lot of pain on palpation over her back, her withers, her sacrum, and I think in the pole. She had conjunctivitis, sunken eyes, and she was very dehydrated. So we did a skin scrape on her because she looked like she had been body clipped really strangely, but on closer look, you could pull her hair and some of the top layer of her skin would come with it. So we were curious as to why that was happening. So we got a skin scrape of her. We cleaned her face up. On her dental exam, she was worn or past the gums, and she had severe hook and wave mouth. So
her hooks were so high that they were protruding up into the top of her mouth, and she had kind of like big punctures right there. Poor thing.
So given all these areas that are very, very painful for her, and given the fact that she was already pretty thin and didn't have really the teeth to manage to gain weight back, the last act of kindness was given to her. She's really cute, though.
She was very saucy. She had strong opinions to the very end. B25-54 was a 3-year-old gelding. He was gorgeous, this beautiful big bay. We called him a thoroughbred Arab cross. His body looked like a thoroughbred, but then his face looked a little Arabian. He was a very strange case. Right off the bat, I noted that he was very, very dehydrated. His capillary refill time was over 4 seconds. So it should be closer to 2.5 seconds. He had a very prolonged jugular refill, so he was very, very dehydrated. His gums were tacky. He had a very narrow chest. So when he was standing, just conformationally, his chest was very narrow and his legs kind of went out. And both of his carpusses were swollen. He also had a heart murmur. His was a point of maximum intensity on the right side of his body. So often in young horses, we hear those congenital murmurs on the right. It's crazy that we get so many heart murmurs.
Yeah.
But he also had his fetlocks would knuckle over and kind of pop out. And that was happening on all 4 of his legs. So he was a very abnormal looking horse. Dr. Gina took radiographs and he had a fracture, a pretty sizable chip in his left carpus. He also had evidence of fracture in his right carpus in a different area. He had a bone cyst in the right carpus. And then just further evidence that the soft tissue structures in all of his legs were abnormal. But poor guy, he was such a good boy to be such a young horse. And I don't know what happened to him, but
Yeah.
Poorly bred and then very poorly cared for.
He's very cute. All right. B25-55 was a 20-year-old gelding quarter horse, and he was already microchipped. So they tried to look him up. Did you find anything on his microchip? I didn't get to hear that part.
We did not find
Any information,
but we do have a.
Okay. His TPR was within normal limits. His mandible, so when we say mandible, it's the bottom part of your jaw, was hard to move, and he was very resistant and reluctant to let us examine him. He was slightly reactive to wither.
This might be an emergency. I'll be right back.
He was slightly reactive over his palpation of his withers, and he had superficial wounds on the left side of his face and his left flank. So they sent him to me for dental rads, and he was missing several of his cheek teeth, and others near where those teeth had fallen out. Their roots were pretty impacted and starting to show signs of disease and change. So based on that, and that he was already pretty thin and having a lot of pain after giving him pain medication, the last act of kindness was recommended for him. All right, I guess I'll continue on. B25-56 is a 22-year-old mare quarter horse. Her heart rate is 88, or was 88 today, but the rest of her cardiovascular exam on auscultation was within normal limits. Her GI and respiratory within normal limits. Her mandible is locked. Her enamel is very brown. So depending on the diet, that changes the staining color of the teeth. But she's also very reluctant to let Dr. Lydia examine her. She has down hirsutism ? So in horses that have metabolic disease like Cushing's, they have trouble shedding out, or they have like a longer shaggy hair coat. So that's why she has that. She's questioning whether this horse might potentially have Cushing's. She had slight digital pulses in left and right front. So she was given pain meds, Banamine. Dental rads, there was not a lot of teeth left. So horses are hypsodonts, so their teeth constantly erupt to a point, and then they get to the very bottom and fall out as they get super old. So she didn't actually have a lot of teeth left to erupt at all. She also had some lucency to one of her molar roots, and her foot rads showed that she had slipper toe, possible rotation, and so we need to look at that more closely on the software that's on our computers. And it looks like after all the findings that we had, the last act of kindness was recommended for her. So B25-57 is a 25-year-old quarter horse mare pony. She had a pulse of 33, so that's within normal limits, a respiratory rate of 16, which is also normal. She had increased lung sounds and nasal discharge, so we got a nasal swab that we're sending off on her. She had a scar over her right hind hock and a scar over the dorsal right hock. So she has it in two different places, sorry. She sounded a walk, though. So she got all of her vaccines, rabies, 5-way strangles. She got dewormed. So she's on our list for sedated dental and hock rads, and we'll see what her nasal swab shows up as. But right now, she's out in pasture.
I'm sorry.
No, you're fine.
That was an actual emergency, but I delegated things. Okay. B2558 is a 22-year-old quarter horse cross gelding. He is a body condition score of 2 out of 9. I was very concerned about how thin he was. He also had a mild heart murmur. I graded it at 3 of 6. But unlike some of the other cases, he was very calm and very stable, and sometimes lesser murmurs can be less significant. Other than being very, very thin, nothing else was super abnormal on his physical exam. So we have him down for a bath. He was very disgusting and covered in mud and poop, a cardiac ultrasound, a dental, and also to have his sheath cleaned. And he's turned out to decompress because he's super sweet and easy to catch, but we're going to try to get to those things soon.
All right. B25-59 was a 16-year-old quarter horse mare. She had pain on palpation, also like of her pole withers, thoracic spine, her right shoulder, right elbow, and right carpus. She had DSLD, left hind and right hind, and she was very toed out. So I think...
I'm sorry, I didn't do a good job with my notes on this one.
No, you're fine. So I think given all those findings, the last act of kindness was recommended for her.
She was very, very uncomfortable.
Poor lady.
B2560 was a 21-year-old quarter horse gelding. Super, super sweet boy. He was a chestnut with a blaze. His resting heart rate was 60. And his respiratory rate was 20. He would inhale really slowly and then have really short, quick exhalation. He also had a very, very severe heart murmur, grade 5 out of 6, that you could hear both on the left and the right. I don't really know why we see so many heart murmurs. And I think, thinking back to being a clinician without this level of severity of sickness, I think it's one of those things that, like, it's a failure to thrive. Like, people are like, we don't really know what's wrong. Why is this horse so weird? Because unless you listen to a ton of equine hearts or do a bunch of cardiac like, I feel like because we have a new ultrasound, the more we ultrasound cardiac pathology, the more I can understand what I'm hearing. But not to criticize GPs out there if these horses were even seen by a vet. I think often horses with heart disease just get really sick and don't do well. Anyway, Lots of heart murmurs today. This horse also had increased respiratory noises on the left, crusty bilateral mucopurulent nasal discharge, coughing, really severe coughing. No lung sounds on the right, which either meant there was no pathology on the right or that the lung was so severely affected it was consolidated. This poor boy also had a really, really painful, irritated looking eyes. He had injected sclera. Basically, if you picture the most red, irritated eye, he had a lot of abnormalities in his right eye. He had some pigmented strands coming from his iris. He had cataracts and punctate cataracts, so 2 different types of cataracts in both of his eyes. His submandibular lymph node on the right was mildly swollen, and then he had atrophy of his apaxial muscles and his gluteal muscles and his biceps. He basically had widespread loss of body mass. He also was lame on his left front foot, and he had a big, stinky, disgusting, draining abscess from the pastern that was really hurtful to him. So we collected a swab of both the abscess and the nasal swab, and then Dr. Gina did an ultrasound of his heart, and he had hypertrophy. So the left side of his heart was bigger than it should have been. And there was extreme regurgitation of the tricuspid valve. So horses have 4 major valves: pulmonic, aortic, mitral that we hear on the left, tricuspid that we hear on the right. And when those valves don't function as they should and blood is flowing back and mixing, it can over time result in the heart being bigger and floppier than it should be. He also had really abnormal lung ultrasound findings. And so Dr. Gina believed that it was likely consolidation or an abscess instead of just, oh, we don't hear anything because it's working, but that horse's whole right-sided lung was so severely affected that it was consolidated. And he was given the last act of kindness and all the cookies.
He was a very good boy.
He was a good boy.
All right. B2561 is a 35-year-old draft mare. She's the lovely chestnut color. She had a normal heart rate, normal respiratory rate. She had increased or hyperperistalsis. So when you listen to her GI sounds, they were really hyperactive. She had evidence of diarrhea. She also has bilateral hypermature cataracts. Her menace was positive, but she had decreased vision bilaterally. Respiratory was at the normal limits. Bilateral vision impairment. Lymph nodes were fine. She had some bad brain rot, and she had 1 shoe on the right front, and she sounded a walk. So we gave her vaccines, and we have her down for a sedated dental, plus or minus dental rads. I didn't look at this horse on the radiograph or CVS cardiac ultrasound or anything because they didn't find anything super alarming about her. Have her down for CBC Chem and a fecal check. And
I am the most concerned about her fecal consistency. I should have documented. She had a lot of diarrhea staining. So we're going to do a fecal and try to see if we can find out more. B2562 is a yearling saddlebred. He's very spicy and very red. And on palpation, I was only able to find 1 testicle. So hopefully we can find the other one. An animal that only has 1 testicle descended is called a cryptorchid. And it seems like no big deal, but actually going into the abdomen of a horse to find a testicle is a very big deal. Often you have to remove the whole small intestine to find the testicle that's way up there. So that's not a surgery that we can do, but we have a great ultrasound and we have a really good team and a really good success rate of finding and hooking and pulling a testicle. So hopefully he's not a cryptorchid, but based on palpation, not sedated, which he didn't appreciate very much. I only found 1. He was sound at the walk and the trot. However, his right front hoof is abnormal and overgrown. But other than that, I didn't note any other physical exam abnormalities. So we have him down for castration. And I need to listen more thoroughly. I was only able to auscult him in our squeeze chute, so I didn't listen to the left side of his heart. And he has turned out separately because he still has at least 1 testicle, so he didn't get to go out with the ladies.
All right, so let's see. We have B2563 is an 18-year-old paint mare. She is very saucy, so she has a very limited exam written down here. So she's extremely reactive to noise. She wanted to try and jump gates, and out of fear, she seemed to try and bite at anybody who kind of approached her face. So based on all those things, she was put into the squeeze chute, and we couldn't really do much with her. So she got her vaccines and her hind legs and the big gluteal muscles, and we have her down for a recheck.
She acted like a Mustang, but she was very confident. So hopefully she mellows out. B2564 is a 16-year-old Tennessee walking horse mare. She's a tall, thin bay, and really liked this mare. I like all horses. I like horses that demonstrate that they're paying attention. So this mare started out, she actually tried to bite me and 2 other members of our staff.
She actually bit a member of our staff.
Yes. She had a cut tail tendon, so I believe that she was a big lick horse. But as soon as we got a halter on her and just kind of calmed the situation down, she started licking and chewing, and she really relaxed and paid really close attention to what I was doing. And then I had to give her a bunch of shots, and she could have bitten me and didn't do it, kind of like, I don't like what you're doing and I'm going to choose not to bite you. So physically, we only assessed her at a walk, but we didn't appreciate any pain on palpation or any overt lameness. She is down to have a dental assessment, a pregnancy check. We pregnancy check anything that we can get our hands on that's an age. She didn't have any signs that she might be pregnant. And I forgot to deworm her, so I have her down to be dewormed next time we have her up. But she has turned out to decompress.
B25-65 was a 25-year-old gelding quarter horse. He was very, very thin, a BCS of 1 out of 9. He was alert, but he was also kind of depressed, dull at the same time, if that makes any sense. Like, he was aware we were there, but he just kind of didn't care. And when you were watching him, even just standing there, his hind end would be leaning to the left, and he couldn't really straighten himself back up. When I listened to him, he also had a murmur. He had a 3 out of 6 on the left and a 4 out of 6 on the right, so you could hear the murmur on both sides, and it was louder on the right side. It was holosystolic, so when you're describing murmurs, there's lub-dub, there's systole and diastole, and it was all during the S1 phase or systolic phase. He was knuckling over on his fetlocks on his hind legs, and he had severe muscle wasting. So we got nasal swabs, and we got some blood work to send off to test for different things. But ultimately, we gave him the last act of kindness just because he was so neurologic.
He was having difficulty eating, too. He would, try to go for the hay and then just couldn't. He had pretty advanced neurologic disease.
Poor guy.
B2566 was a 3-year-old miniature horse stallion. He was a beautiful black Tobiano. He'd had some trauma to his face that had resulted in the complete loss of vision on his left side. So he was a little jumpy over there, but he had really significant, you're going to have to jump in because I don't remember what the rads are.
No, you're fine.
He had a significant lameness on his right hind. He had I remember now. He had overgrown feet. He had a very thick, crusty neck. And when Dr. Gina took radiographs of him, he already at age 3 had slipper toes. So when we have chronic inflammation affecting the coffin bone, so here's the hoof and here's the bone, this bone is supposed to be nice and smooth. And this horse's bone was pointy out like this. There was a little osteophyte, a little piece of bone that had come out in a slipper. And so as the body makes new bone, it remodels in response to pressure. And that's an indication of chronic inflammation in his feet.
He had rotation in both of his front feet, and he also had evidence of either pedal osteitis or lytic lesions where the tip of his P3 on both of his feet was being resorbed. So he was at risk of a fracture in both of his front feet inside the bone.
And he was so lame on both of his front feet that his hind limb lameness was more obvious, but he really only had one leg that wasn't causing him discomfort. And so after we saw those radiographs, the way he was walking made more sense. And he obviously got pain medication. He was given the last act of kindness.
Yeah, he was real handsome. B25-67 is a 22-year-old gelding quarter horse. We don't have much of his TPR written down, but says within normal limits. No, you're fine. It doesn't look like he had any signs in his dorsal quadrants of his GI, but his ventral quadrants had hyperic noises, so he had evidence of diarrhea. He had blepharospasm, conjunctivitis, but no stain uptake in his right eye. He had, looks like his cornea was within normal limits, so I'm not sure why he had blepharospasm, but otherwise he looked pretty unremarkable, sounded a walk. So he got his vaccines, he got some pain management. So we have him down for dental, optho exam, recheck nasal discharge, and clean his sheath. We did take a nasal swab of him today.
B2568 was a at least 33-year-old quarter horse gelding. I think he actually was probably older. I had to guess on his age. He was bay, and he was very, very sweet. And his right stifle, you could hear it when he walked, popping, and it was so swollen and warm to the touch that I could feel the heat radiating from like an inch away on his body. Dr. Gina, I gave him pain meds. Dr. Gina's team took radiographs of that area of the right stifle, and he had a fracture on his proximal tibia. He also had severe osteoarthritis throughout his thoracic spine with really, really severe mineralization of the nuchal ligament, the part that runs over the neck. He also had multiple issues with his dental roots, and his teeth were worn to the level of the gums. Poor buddy. But it's just really sad. I don't know how a super sweet, super old horse breaks a leg. And it looked like a fairly recent fracture. There wasn't any remodeling. So I would say less than 4 weeks old.
Maybe he got kicked or something, but he was super sweet.
He's a good boy.
B25-69 was a 7 to 8 year old. I think
She was a Mustang.
Yeah, Mustang.
I said she was great, but she was a Mustang.
She had a brand on her neck, so Haley looked it up, and she was about 8 years old. You could hear this mare. So she was having difficulty breathing, and we thought she might have had like either some kind of hematoma or some kind of mass in her nasal passages. But when we got her in, Dr. Lydia noted that she had a ring around her face with scarring that looked like she had had some kind of laceration or something had happened, and she had nerve paralysis or nerve damage that affected everything below that scar. So her top lip had no innervation, so she couldn't prehensile it or move it around like horses do to pull food in their mouth. And anytime she breathed, her nasal passages would actually collapse. And horses are obligate nasal breathers. They don't really breathe out of their mouth very well, which is why sometimes we get horses that have the tracheostomy tubes and stuff like that come in. So based on all that and the length of time that those scars had occurred, so we think it was an older injury, even though she had one part that still had some active bleeding. The prognosis of her regaining facial stimulation and innervation in that area and being able to eat normally and breathe normally. So based on the poor clinical prognosis and the risk of her going into real respiratory distress where she could just decompensate rapidly and in a fearful state, she was elected to give in the last act of kindness today.
And after she had passed, I palpated. It's pretty invasive to stick your hands up, but I was able to palpate what we saw on radiographs was the nasal passage going to about the diameter of like a drinking straw, and I could actually feel. So normally we can pass a tube all the way up a horse's nose, easily. That's like this diameter without any resistance. And in this mare's case, the diameter went from about this to about this, and I couldn't even get my pinky finger past that point. So there was nothing we could do. Also, postmortem noted that she had really severe vaginitis and some pretty bad discharge coming from her reproductive tract. So we didn't catch that before she passed, mostly because she didn't want us examining her back. The last horse that we looked at today, B2570, is a 2.5-year-old Tennessee walking horse gelding. He is a lovely looking young colt. He was a bit wound up, but once we had him caught and calmed down, he was very, very responsive and great to work with. I didn't appreciate any abnormalities on my physical exam except a very superficial abrasion over his left eye that looks like had just happened, probably in the trailer. It wasn't full skin thickness and it didn't need stitches or any treatment. I did note that I wanted to recheck listening to his heart and lungs when it was a little bit more quiet. He was a bit wound up and a lot was happening. It was the last case of the day. And so I didn't feel like I got a great listen to his heart and lungs, but he'd already been castrated. And hopefully he will do well and get adopted. And that's the last horse that we went through today. It's a very depressing day. We have 4 more from our buyout group that we didn't get to examine today. 3 of them look to be about a year old. And then one of them is a little baby mule, a mule baby who's very cute. But those guys were stable and they're together in a group for tonight and we'll get eyes on them tomorrow.